Let's talk about something critical: the way we approach mental health treatment. Not all disorders are the same, and not all treatments should be either. For instance, borderline personality disorder, BPD, and post-traumatic stress disorder, PTSD, are two very different conditions that require fundamentally different approaches. BPD is typically developed over time, often rooted in a combination of genetic predisposition and early environmental factors. Treating BPD involves a multifaceted approach. Cognitive behavioral therapy, CBT, is essential to help patients understand and reframe their thought patterns. There's also education on psychosis and neurosis, helping them distinguish between distorted thoughts and reality. In many cases, medication plays a key role in stabilizing mood and reducing symptoms like anxiety or depression. This structured, long-term approach is what helps individuals with BPD regain control over their emotional and mental well-being. Now let's compare that to PTSD. Unlike BPD, PTSD can happen in an instant. It's often the result of a single traumatic event that overwhelms the mind's ability to process and cope. Thus, a healthy person, someone who's never shown signs of mental illness, can develop PTSD after experiencing something deeply traumatic. And here's where the treatment approach shifts dramatically. PTSD doesn't respond as well to CBT or structured programs like the 12-step method. Why? Because those approaches often focus on managing behavior and cognitive patterns, but they don't address the core trauma. For PTSD, the goal is to process the trauma, not just manage its symptoms. And the best way to do that? Talking over and over and over. It might seem counterintuitive. Why force someone to relive their worst experiences? But here's the key. Repetition reduces impact. The more someone with PTSD talks about their trauma, whether in therapy, in group settings, with friends, or even just journaling, the less power that trauma holds over them. The brain begins to desensitize to the emotional weight of the event. Over time, what once felt like an overwhelming memory becomes just a memory. This process, often called exposure therapy or prolonged exposure, helps rewire the brain's response to trauma. The more they talk, the more the trauma integrates into their broader life story, rather than existing as a haunting, isolated event. Even when they don't want to talk about it, pushing through those moments is crucial. Avoidance only reinforces the fear and keeps the trauma alive. What's fascinating is how different these approaches are. Someone with BPD might need to work on regulating emotions and understanding their triggers, while someone with PTSD needs to face their trauma head-on. It's proof that mental health treatment isn't one-size-fits-all. Here's what's important to remember. For PTSD, emotional behavioral therapy, not just cognitive behavioral therapy, can make all the difference. It's about engaging with those emotions, not avoiding them. And as unconventional as it might seem, the act of repeatedly discussing the trauma helps neutralize its power. This technique has helped countless people reclaim their lives from the grip of PTSD. Ultimately, healing looks different for everyone. Whether it's structured therapy for BPD or repetitive emotional processing for PTSD, the goal is the same: to regain control, find peace, and move forward. The human mind is incredibly resilient, but it needs the right tools and approaches to heal. So if you or someone you know is struggling with PTSD, encourage them to keep talking, even when it's hard. And for those with BPD, don't underestimate the power of education, therapy, and sometimes medication. With the right support, healing is possible for everyone,